Reaction to reported job cuts at SAA is SCOPA chairperson Mkhuleko Hlengwa. Let's continue here. The Gauteng Health Department has received personal protective equipment donations from private companies. These are expected to assist the department with the shortage of face masks and other protective gear. We're joined in studio now by Newsroom Africa's reporter Sipa Kema, who was with the Gauteng Health MEC Dr. Bandile Masuku. Sipa, good afternoon to you and thank you so much for joining us.
Good afternoon, Lindy.
I mean, we heard the Gauteng Premier David Makhura speaking about how the worst is still to come. Efforts to fight COVID-19 need to be redoubled. But just how bad a situation is this issue of PPEs? I mean, we're hearing health practitioners speak about how do we carry out our jobs if we're not protected in the front lines?
And that is true, Lindy. I mean, in the beginning, just as we had our first case of the COVID-19 in South Africa, there was a lot of concern and worry around, around how, whether we have enough medical supplies and also personal protective equipment for the healthcare workers at the front lines. But of course, as a country, we've seen that there have been donations that have been coming through from other countries. We saw Germany as well assisting South Africa. That is on a national basis. Now, with Gauteng, as I've followed them through their journey, of course, the COVID-19 journey, we've observed that a lot of private entities have actually come forward to assist them, not only with medical supplies and your PPE, but also in a way of cars. I mean, just 2 weeks ago, we saw Peugeot donating cars to assist with tracing, where tracers can actually be mobile to go around the province to contact the COVID-19 confirmed cases contact lists. So this will assist them in terms of mobility, as we know now that the numbers are continuing to rise. So therefore, they need to intensify their programs, and this will assist. And I'm sure, Linda, you've heard of a few health facilities who have reported not having enough PPE, and some, as a result of that, private as well, you found that the healthcare workers, they have tested positive for COVID-19. So the donations will help to ensure that these workers are protected, as you mentioned, that they are at the front line.
Yeah, sure. Well, let's speak about the donations that were made by these private companies.
Yes.
Who are these private companies? And, you know, these donations, how will they be allocated?
Now, today we were at Baragwanath Hospital. Now, Baragwanath Hospital, we know it has an influx of patients coming in, whether it be at the maternity ward, casualty, trauma. It has a large number of people coming in, but also at the same time, we're talking about the world's third biggest hospital. So they definitely need to be equipped for what's to come. So today, Transnet donated medical supplies, including personal protective equipment worth 5 million rands to the Baragwanath Hospital, which I'm sure is a financial relief when it comes for the Gauteng Health Department as well. So since they know that Baragwanath Hospital has been taken care of, so now they need to ensure that they shift their focus elsewhere as well. Now, as you asked, where are these going? These are going to Baragwanath hospitals, but the other donations, like China, World Bank of China donated 31,000 PPE units, and those are going to be spread out throughout some of the hospitals that have been designated to take care of the COVID-19. Now, I know you're probably asking private hospitals, what's happening there?
Yes.
So we spoke to the MEC today, and he said that he believes that they have enough money to buy their own equipment. But what they're going to do is to ensure, as of course it's also their responsibility as the health department, to ensure that the workers are protected and that they are given the needed equipment that they need to ensure that they work within the COVID-19 pandemic.
Okay. Yeah. I mean, one of the things and one of the areas that are not spoken about is the people that are on the ground. So the people who are doing the screenings in the communities, they also need to be protected. You know, what's been said about them? What's been done to ensure that they also have these PPEs? Now,
besides the healthcare workers' PPEs, which of course we've seen them wearing the full screen masks, the masks that cover, of course, the nasal area as well as your mouth. They also have the gloves and the protective sheets all around them. Now, with these healthcare workers, and some of them are actually community-based workers that have been put in a program to assist with training and screening. Well, they, of course, supplied with the masks and also the screening gadgets. I mean, today we saw a number of those handed over at Baragwanath Hospital, with, I'm sure, they're not just going to stick to just the hospital. Of course, they're going to distribute them amongst the province to ensure that they have at every part of the province that is needed. As we've seen that they've had mass screenings throughout different, especially the dense areas of the province and of the country, and which are the places that they are targeting because they are high risk for COVID-19.
Well, thank you so much for that. Our reporter, Sipa Kema, she attended the handing over of donations of personal protective equipment that took place at Baragwanath.